Since we now have people who have recovered from the coronavirus, is it possible to develop some sort of treatment using the antibodies that they developed as a response to the disease?
As a matter of fact, that's exactly what we're doing. We're gearing up for a study of both convalescent serum, which is a big word to say taking the serum from someone who's completely recovered, getting it in a way that you can reinfuse it in somebody else, or getting out the proteins, the gamma globulin, the antibodies from that serum, and use it as a way of both treatment and possibly prophylaxis, but mostly treatment. Very good question. It's one of our top priorities.
If someone in a restaurant who is either ill with the virus or is not aware that they have the virus comes in contact with the food or the packaging, is it then possible that I can contract the virus through that food or the packaging?
What about that?
So it's interesting. So first of all, you're not going to get it from the food that you're eating. This isn't one of those types of viruses. It is a respiratory virus.
I think the highest risk moment in getting food delivered to you is actually the face-to-face interaction, if you have one, with the delivery person. So ideally, you would be able to pay them online, tip them online, or whatever platform you're using for ordering food, and then have them leave it outside your door. Wait till they leave and then get the food.
Are we being advised to stay away from local, state, and national parks and beaches at this time as well? I want to still be able to enjoy the outdoors, but do so responsibly, following social distancing and other recommendations.
Yeah, we hear this a lot. Sanjay?
Yeah, look, I mean, there's no reason why you can't go outside. It's one of those things where you talk about the social or physical distancing, as I like to call it. You just got to maintain that when you're outside as well. And if you're exercising, if you're riding a bike or something like that, make sure you're wiping surfaces and still practicing good hygiene.
Despite pleas to remain calm, some people can't help but panic or get nervous in a time of crisis. Many of CNN's correspondents have traveled to war zones. They have covered unimaginable brutality and despair. Nick Payton Walsh has witnessed conflicts in places like Syria, Iraq, Venezuela, Iran, Afghanistan. He joins us live now from London to give us a little bit of perspective in the middle of this very big story. You know, Nick, you have a new piece on CNN.com. What are some of the lessons you can share from your experiences?
Well, just immediately, practically, don't worry so much about food. And a lot of people are panic buying, but one of the things me and many of our colleagues have learned from crises and conflicts around the world is that people have an extraordinary ability to feed themselves in times of crisis. Often when there's shelling or on a front line or houses are turned to rubble. This is just a disease. It's an awful one, changing our daily life, but don't worry so much about food and don't behave in such a way that you deprive food from the elderly or the vulnerable by panic buying and emptying out stores. We're seeing it all over the world. It's kind of crazy. One point too on that too as well, you can live without toilet roll. We've all done it in our jobs around the world. If you have to do your business in the middle of a field, yes, it's very helpful, but it's entirely possible to exist with just a shower and a bar of soap. So don't worry too much about that either.
Some of the things you make a really good distinction, Nick, between things you can control and things you can't control. Elaborate.
Yeah, I mean, one of the things we have to learn in our job in complicated situations like conflicts is that there's stuff that you can worry about that you can have an impact on, and there's stuff like what's going to happen in May, what's going to happen in the other village that you can't see, the distant future that you simply can't change. So don't waste your energy worrying about those things which really you have no control over at all. Worry about the things you can change. Who are you going to help today? What are you going to eat today? What are you going to do later on today? What are you going to do about tomorrow? Try and limit the things that your anxiety builds over. And also, too, an extremely important thing for people to remember, be nice to people around you. This isn't because we all want to live in a happy society holding hands. It's really, really helpful for you if people around you like you and want to help you, because they will tell you things that necessarily they might be reluctant to tell you that you really need to know. Your neighbour's sick, or in my case, sometimes we're going to shell on the other side of that hill, so don't go there. That's an important matter of fact, not altruism, but for looking after yourself.
This is what Chinese cities usually look like this time of year. Thick smog blanketing the skyline. But this year, there's something different in the air. Blue skies. In several Chinese cities, the air pollution has improved. Especially Wuhan, the original epicenter of the deadly coronavirus. The face masks many Chinese used to wear to filter out polluted air, now worn to protect against the virus. NASA and the European Space Agency released satellite images from January showing Wuhan's nitrogen dioxide levels, and the dramatic drop in February after 11 million people there were quarantined.
CO2 emissions for the past 4 weeks are down by at least 25%.
For the world's biggest polluter, that could mean a drop of 200 million tons of carbon dioxide.
This is more dramatic than anything else that I've seen in terms of the impact on emissions. But of course, the impact on people's lives and the economy was equally dramatic.
The Center for Research on Energy and Clean Air says coal consumption at fired power stations saw a 36% drop compared to last year. Their research also shows carbon emissions from the aviation industry plunging due to falling demand and widespread travel restrictions. In neighboring Hong Kong, air quality has also improved as the virus triggered partial shutdown.
There are lots of people who work from home, and that reduced the traffic volume and reduced the traffic congestion.
Activists like Patrick Fung have been warning about the long-term impact of air pollution in his home city for years. His Clean Air Network released this dramatized public health warning.
There's a 1,500 premature deaths 1 year alone in Hong Kong that is caused by air pollution.
One researcher at Stanford University estimates the sudden improvement in air quality over China may actually save tens of thousands of people from premature deaths due to air pollution. But even environmental activists warn it is far too early to celebrate. In the short term, the air over China may be cleaner, but no one knows the extent of the consequences this deadly pandemic will have on society. Ivan Watson, CNN, Hong Kong.